Hello, it's Dr. Christine Arseneau here today. And if you are in pain, today's video is for you. Wanted to talk about chronic pain and the factors that make it worse that you might not be aware of. So pain is definitely something physical that happens in our body, but it's also something that happens in our brain in the way that we perceive it. So pain is not always the same. You could take a hammer and you could hit your hand with the same exact force and have different pain experiences depending on other factors. For instance, if you were working on a project that you hated, you had slept really poorly the night before, you had eaten fast food, and you were lonely, you're going to have more pain, a different pain experience than if you had been working on a project that you loved, surrounded by loved ones, friends that you enjoy being with, you slept great the night before, you ate some anti-inflammatory food. Your pain experience is going to be a lot different. And I think sometimes we overlook some of the other lifestyle factors, some of the other things in our environment that can actually affect our pain levels. So I wanted to go over that, and specifically inflammation and pain. It's really common in our society, and our society now is a lot different than our ancestors' world. And so that's what I wanted to highlight, the factors that make pain worse that are different than our ancestors and the lives that they lived. And so inflammation is a huge problem. It's that chronic smoldering inflammation that is responsible for a lot of health conditions, not just pain, but cancers and heart disease and a lot of these chronic conditions we have in our Western world. And that's because our life is a lot different than our ancestors. And so I'm just going to point out those factors. So one of them is sedentary. We live a sedentary lifestyle versus having movement. And a sedentary lifestyle causes inflammation. We're not out hunting for food all day. We kind of live in little boxes. A lot of us work in boxes, live in boxes, where we're just sitting down a lot. We might sit at an office job and then come home and sit in front of the TV, and our bodies were built to move. So this causes inflammation, which makes our pain worse. Being indoors, we're disconnected from nature versus being in nature with that rhythm of lightness and darkness. And that circadian rhythm that is set by being in nature helps us with pain management. It helps us with our melatonin levels, which are anti-inflammatory. It helps us with our cortisol levels, which causes inflammation. So being out of touch with nature is one of the factors that influences our pain. We're also socially isolated compared to our ancestors who had tribes that they needed in order to survive. And loneliness is a big factor in how you experience pain. Fast food laden environment today compared to our hunter-gatherer ancestors. So when we get away from eating whole foods and eating anti-inflammatory foods, that can impact our pain. It also impacts our gut. So if we have dysbiosis in our gut, that breeds inflammation, which causes more pain. So it's really important to address your gut if you want to address pain. Sleep deprivation is a huge problem in our society today. We are a bit of a go, go, go society. I'll sleep later. That affects our pain levels directly. In the olden days, we would go to sleep when the sun went down. And now we are up at all hours, checking our phones, having added stress and distractions that keep us awake. And sleep deprivation results in 15 to 30% increase in pain sensitivity. And then we just live a frenzied life, a stressful life versus a more boring life that our ancestors led. We're meant to really live a boring life, not have all these novelties and constantly be seeking out things. And that stress, even if it's good stress, it's just our body perceives it as stress, which causes us to create cortisol, which causes us to be inflamed. And it's a much different world where we're always on our devices. We're always bombarded. It's really bad for our brain when we're constantly being interrupted and switching tasks as well. And emotions, mood, mindset, all of those affect your pain. Past traumas in your life is a big one as well. But our mindset around the pain, our mood, that affects our whole experience with how we tolerate pain. And chronic pain is also associated with neuroinflammation. So an inflamed brain is going to affect our mood. Chronic pain is associated with increased risk for insomnia, and we know sleep is going to affect our pain then, so it becomes a cycle. And chronic pain is also associated with increased risk of anxiety and depression. So it's important to look at all these factors so you can actually make an impact and have some shifts in your pain levels. And so when we address inflammation, which is really the focus for how I work with clients, is really looking at inflammation. When we address that, we can address that through lifestyle factors contributing to it. We can decrease not only pain, but we can also decrease brain fog, and we can decrease fatigue. All of these causes, inflammation is a big part of them. And you can really see your symptoms shift quickly if you focus on inflammation. And I do this in a comprehensive way where we look at all those lifestyle factors, as well as effective natural supplements, as well as hypnotherapy to rewire your subconscious mind. Again, it's really comprehensive. So we are looking at food. We want to nourish ourselves with things that are healing to our gut so we can decrease that inflammation there. And also quiet time and rest and meditation, mindfulness, all of these things, being able to incorporate those into your life can go a long way in activating your parasympathetic nervous system, which is where you heal, instead of that sympathetic nervous system where we just have this ongoing stress that's breeding inflammation in our life. And so I teach you how to manage those triggers of the stress and also how to change your response to the things that you can't change. And I love incorporating hypnotherapy. It's really important because you have to show your brain what your new reality looks like. So your brain's job is to keep you safe. Your brain does not like change. It wants to keep you in the safe known. And it's the brain's job to conserve energy, which is why we create habits. So we want to stay safe, familiar, predictable. And you have to program yourself with new thoughts, new beliefs, new feelings, and new habits to create that new life. And hypnotherapy allows you to do this just in a much more quick and effective way, and also to implement habits that are then sustainable. It also helps with relaxation, and even self-hypnosis does this. Long-term, it can decrease pain. There's studies that show the effects have been maintained for up to 12 months in some patients, and this is for chronic pain. And hypnotherapy has also been shown to have significant improvements in sleep and mood. It also allows you to process traumas without having to relive them, but simply by removing the blocks that are keeping you stuck. And when you have a comprehensive approach and you work with a coach, you can get to your goals faster and easier and have a proven path instead of trying to figure it out all on your own, spinning your wheels, having your ups and downs with pain, and just not knowing if you're on the right track. So if you're ready to really take care of inflammation, address that pain and fatigue and brain fog, go ahead and send me a DM or click on the link in the comments. I'm going to post my schedule link. You can apply to get on a call with me so we can start getting some shifts and having you live an energetic life free of pain. Looking forward to talking.